So the Northern Cape Health Ombudsman just released a report announcing that 2 mental health patients have died and one has been permanently disabled in the Northern Cape Mental Health Hospital. Now, listen to this story. This is a beauty. It's too disgusting for words. Power went out at this Northern Cape Mental Health Hospital and wasn't attended to for a year. Okay? The power went out, cables were stolen, it's the usual story. And management at this mental health facility did nothing about it. This was not a problem that happened only at this mental health hospital. The power went out, but all the private clinics around there got their power working within days. These guys did nothing for a year for mental health patients. Needless to say, they went through a harsh winter and people died inside the hospital of exposure. This sounds almost Victorian, right? And let's not forget that under the ANC Gauteng government, the then health MEC, Gadani Mahlangu, sentenced 144 people to death by taking them out of private facilities and putting them into unregistered NGOs, killing 144 of the most vulnerable people in our society. To date, nobody has paid a price for that. In fact, the ANC tried to put Gadani Mahlangu back into their leadership in the province of Gauteng. Now, this isn't a story about the Northern Cape Mental Health Hospital, which is disgusting in and of itself. This isn't a story about Gauteng health situation run by the provincial government, where they don't care how many people they die on their watch. This has got to be a discussion around national health, right? Around the so-called NHI, which in effect is going to nationalize our private healthcare system. Because the government is unhappy with the fact that there's going to be electricity in the private hospital, but the government hospital, the guy doesn't really get off his chair to go and get the power restored at his facility, and he gets paid more than his counterpart at the private hospital. Somehow our Minister of Health and our President thinks that if you nationalize the private health care, that those good practices will go into the government hospital and not vice versa. Now, understand that if there's one hallmark of the last 30 years of governance in South Africa, it's been the lack of building of new facilities. In which city has a brand new hospital, of some sort of scale being built? Been a few odd clinics in small places, but no real big hospital. The hospitals that we use in our cities and in some of our big towns are still a remnant of the past. These were hospitals that were built before 1994. But the people entrusted to look after those buildings have just not done it. They're just not incentivized or managed. There's just no repercussion for bad job done by our management at hospitals. And we saw recently that in Gauteng, members of the ANC Youth League were put onto boards of government hospitals. Now, how is that going to add value? But most importantly, the level of trust between the citizenry and the government is quite understandably so low that the government thinks that the only way you can restore that confidence is to force all of us to use government health facilities and not privatized ones. Well, here's the newsflash. Not even the government members, not even those ministers themselves will use those government facilities, but they want the rest of us to use it. Now, ahead of the election in 2024, the ANC, trying to rescue a vote, at that stage polling at 45%, about a week before the election, rammed through the NHI Act and signed it into law about 7 days ahead of the election, and promptly lost just over 5% of their support. Reason being is that even traditional ANC voters don't trust the ANC with healthcare. Anybody who's got access to private health facilities and medical aids will not vote for a party that wants to take it away. This raises the question of why do we think that this is the solution? Why do we think that the solution is to collapse what works into what doesn't work? Our government National Health Service, as we have in the country, is far bigger than private healthcare, but it's just not treated with any seriousness at all. Because the bottom line is that the ANC do not care about the well-being of people. Otherwise, they would have eradicated easy things to eradicate. Pit toilets have already been eradicated within a year of the new minister taking over as Minister of Basic Education. Not hard. You just get off your jack and do what you have to do. And there's repercussion if you don't do your job. But within the ANC, there is no desire to provide a better living standard for people. Or in fact, they couldn't even give a damn, and the most vulnerable suffer. It always seems to be mental health patients. Why? Because they have the smallest voice. Who is going to believe them when they say, I am freezing to death in this hospital? It's not like me, I've got a microphone. It's not like you where you can write a letter to the editor or some rich person. No, it's the poorest people with mental health problems that the ANC have proved they could not care about. Now, if you out there think that the ANC cares about you and your health, I think you better start thinking again. Now, I have mentioned the ANC a lot. They don't govern alone. They govern in a government of national unity. Health has been one of those departments that they have kept out of the hands of their GNU partners. But that doesn't give those GNU partners the right to sit by and let this happen. They are also part of this government. If they don't like what's going on, they should speak up or get out of the government of national unity. It is driving me mad that these parties are in the government of national unity and they do not hold the party, the ANC, to account in those particular ministries where the ANC is doing such a poor job. Health is critical. Health care is critical. It's not fun to go out there not knowing what you would do if you broke a leg, or knowing that if you have the most minor ailment, you're going to have to stand in a queue in a dirty hospital being treated by people that treat you worse than animals are treated. It's a very, very sensitive issue, and it deserves our attention. And I am all in favor of us improving our healthcare for everybody, because that net has to be there. All the indications show that a healthy population is a productive population. Economic growth is often linked to healthcare, so it's important that our government gets their act together. But for God's sakes, will somebody please do two things? Will they get rid of this idea of national health? And will they get rid of Aaron Motsoaledi as the Minister of Health? Because these ideas and that person is going to kill us all. Thank you so much for joining us on the Political Insider. I hope you're as mad as I am. We'll see you again soon.